And thank you for joining us today. My name is Hugh Bailey. I support the outreach efforts for the Work It Health program. Thank you for being here. I will be your host for today's session. Welcome to Third, a series of events that provide you with information about Work It Health and workplace wellness. Today, we'll provide an overview of the technical assistance that is now available to those employers that have been trained by Train the Trainers. This assistance will make it easier for you to complete your wellness program and ensure that it meets your corporate and organization wellness needs. Before we begin, a few important notes and reminders. The event is being recorded. The recording is available upon request to our Work It Health Customer Service Center. The audio of this event is provided via broadcast. If you need technical assistance or need to ask a question about today's topic, please use the question and answer panel on the right side of your screen. Although we will have a Q&A segment after the interview, you may set a question at any time during the session. There is a 256-character limit to the questions that you submit. Lastly, please note that this webinar is provided for informational purposes only. Participants should consult independent professionals to discuss how specific aspects of the technical system may impact your business or organization. Now, to introduce today's special guest, Ms. Nikki McCoy, the Director of the Technical Assistance for the Work It Health program with Ashland Management Group. Ms. McCoy is a North Carolina native and brings 17 years of public health research experience to the Work It Health program. Nikki, welcome, and thank you for being here today.
Thank you, Hugh. It's my pleasure to be on the other end of the interviewing.
I can imagine. We're going to get started. We have a number of interested and excited participants in our session today. And so we're going to jump right in here. And I want to just get started with following up with you around the fact that many of the participants on the line today are familiar with Work It Health, but they may not be familiar with technical assistance. Can you describe for us Work It Health technical assistance?
Sure. For Work It Health, technical assistance is a continuation of the training. Technical assistance program participants are encouraged and provide support so that they can implement the principles that they learned during training in order to enhance or establish their worksite wellness programs. Technical assistance, I found, is one of the most valuable tools that employers who are participating in the program can use in order to support their efforts. Here's a graphic on the screen. For technical assistance has two major components. The first being, or not the first, but one of them being structured technical assistance. And that includes the things we plan, the scheduled and planned webinars, Q&A sessions, a lot of our archived materials, presentations that we've given or that we've used from experts, as well as the resources housed inside of our technical assistance learning community. But on the other side of that, there's also organic technical assistance. And that's the more peer-initiated events, things like group meetups. We encourage that. We encourage peers to really bounce ideas off of each other and really build that team collaborative experience, because we know that we don't have all the answers. We want to provide a community so that employers can learn in different industries or from different parts of the country. We also include in that organic TA conference calls and virtual meetings, and all of that organic TA is really driven by the needs of participants. So the structured is more the routine information that we want to make sure we push out to everyone, but the organic is more based on the needs of individual employers. One of the ways that we provide that is through technical assistance providers. These are subject matter experts that are assigned to program participants. And many of these folks have years of experience, and for employer participants, they'll provide the guidance and consultation and coaching throughout the entire technical assistance period at no cost to the employer. So when we look at this resource, it's a very valuable resource. If an employer were to go out and hire a consultant to provide this level of hands-on support, you know, we estimate that that could cost somewhere between upwards of $2,000. And our technical assistance providers really provide that for employees an opportunity to get that expertise. And technical assistance provider really focus on being responsive to the needs of program participants and providing the kind of timely and appropriate advice and really directing the employers through the steps that they need to plan and implement and evaluate their programs. Also, you'll see on this graphic on the left side are milestones. So for employers in work and health technical assistance, there's an opportunity to use real science-based staged approach to implementing your worksite wellness. And there are 4 milestones that we really work program participants through. And those are listed there: assessment, planning, implementation, and evaluation. So during that assessment period, employers will really look at, and I want to back up just a little bit. In those 4 stages, what you'll see is some of the folks here on the phone and participating in the call, you have been trained by the T3 participants. So you're in this phase right now. We have been in contact with you. Many of you have filled out applications in order to participate, and if you haven't, we really will encourage you to do so, hopefully with the information that you've learned. Because you've met our criteria, you're not eligible for technical assistance. And being eligible for technical assistance means you'll have access to those technical assistance providers I mentioned. They are subject matter experts in the field of worksite wellness, with many of them subspecialties and other things, and they will provide you with support. So there are 4 major milestones which we would mention, and the first one is assessment. And something you'll find common across all of the milestones is that we have required attendance to a webinar, and those webinars are a part of that structured technical assistance that I mentioned earlier. In addition, we'll try to work you through certain assignments that will help you get closer and closer to establishing or enhancing your worksite wellness program. So during assessment, we've encouraged all of you, many of you have heard from our team, to complete the CDD Health Scorecard. You'll also complete an organizational assessment, and we'll want those results reported back to us so that we can help you identify any gaps that you have. And those gaps identified will help you really work through the process. So next steps are really giving us that information in a progress report. And I know it seems burdensome, but we really need to be able to track that progress through the program to make sure that we are providing you with the best service possible. And so in each milestones, you'll see that in planning, you'll create plans based on the gaps that were identified in the assessment period and determine what program or programs can be put in place to close those gaps that also meet the needs of your employees. And during the implementation plan, the technical assistance provider will provide coaching and feedback on how that plan was actually implemented real world. In addition, the technical assistance providers will help you think of alternative options. So it may be that something didn't work, and you want to try a different program, or option 1 was not positive, so you couldn't do a specific program, and you'll want to be able to do that. And it'll also help you plan to evaluate your program. So during this implementation, we really want people to be thinking about how their programs are implemented and how they can be evaluated, from things like reporting participation rates to also looking at your employees' satisfaction with the program that you implemented. And that can be very helpful looking at the success of your program. And then finally, during the evaluation phase, guiding employers through completing any data collection and how that information can then be reported to us. As I mentioned, progress reports are expected at each end of each milestone, but we don't want those to be a burden, and it really helps us report to CDC the success that you have as an individual participant and also the success of the program overall.
Sounds like that while the participants are going through technical assistance, there'll be someone there to guide them and assist them through every step of the process. And so this sounds like a wonderful first step. Let me ask you, how will technical assistance affect employer ability to implement their health and wellness program?
That's a great question, and oftentimes when I'm asked that question, I use an analogy. I say this is where the rubber meets the road. And so we know that many of our participants are passionate about workplace health, but very few of us, and I include myself in this when I first started, are and those employees who are working in companies have expertise or have the time to devote solely to workplace wellness initiatives. Many of our participants have multiple responsibilities, and they're really looking out for the health of their fellow employees by wanting to implement these programs, but we know that they don't have all of the time in the world to devote to these efforts oftentimes. So here in technical assistance, we provide employers with the ability to tap into the expertise of a technical assistance provider, as well as providing other resources on various topics during webinars, providing resources, a framework for how to implement a program plan, options on how to engage health promotion committee. So we use this information to bolster the wellness program and ultimately improve the health of the workforce. I mentioned earlier alternatives. So these technical assistance providers will really work sort of lockstep with employee participants to help them strategize on ways to work toward wellness goals. So for example, if you're an organization in which the management or leadership is not supportive, there are resources available in your TAP. Your technical assistance provider can provide you with information about cost savings that come from having a healthier workforce, how improving the health of your workforce can increase productivity and have a positive impact on your company's bottom line. So providing you with tools, even say ammunition, in a maybe not so positive environment. So we want to provide you with those tools. And the technical assistants, our team, our technical assistance providers can act as a sounding board and provide you with the community sort of support that you need to learn, interact with maybe your leadership. I often say that 2 heads are better than 1. Well, think about what 10 heads could help you. Maybe you have in your community, in your group, someone who works in an industry similar to yours or even very different. They can help you think of things that you may have never thought of. And as I said, technical assistance is a possibility, has the possibility of providing, being a resource for even newbies who don't have a lot of experience with workplace wellness. Maybe your training by a train-the-trainer participant was the first time you had real interaction with workplace wellness, to even those with established programs, those who are maybe looking for new ways or new avenues to enhance that current program. So we can meet all of those needs with our technical assistance and hope to put that to all of our program participants.
So now that with a combination of the technical assistance and the training, our participants should really be able to implement a program that is comprehensive and meets their corporate needs. Would you agree to that?
Hugh, I think we don't expect for people to start in technical assistance and have a fully functioning every aspect of wellness to be covered and for them to then make a perfect score on the CDC Health Scorecard at the end of the program. But we want to supply you with that spark, really get that started, getting a program in place so that you can see the benefits A lot of people speak on the benefits of having early wins, and we want to help you capitalize on that, help employers really work towards the success of a program so that they've broken down maybe the barriers of having a negative management or having apathetic employees. So those kinds of things we want to be able to get folks rep and get it started so that they can go on and supply them with tools. And I want to say that the interaction with the work and health community doesn't end with the end of technical assistance. So program participants have access to all of these resources in a continuing basis so that they maybe not have been able to implement a walking program, in the last 6 months, but they know it's something that they want to do in a year, and we have those resources still out there and available.
I know that those early wins are very attractive to those I've spoken with. Well, a couple of quick questions. I know now that we've talked about the program, people are very interested in some of the practical aspects of Work at Health. And so to begin, when does the technical assistance begin?
So we'll use for this technical assistance in 2015 a staged approach, providing technical assistance to those employers who were trained by the trainer. So we'll start our first group on May 1st. For those of you who are still considering participating, please go ahead and let's sign up. And as I said, you'll have an opportunity to complete that application. But, if you're still thinking it over, we will be starting another group in August, and I don't want people to put off participating. Those early birds, as I say, the early bird gets the worm, we'll have an opportunity for even more exposure to the program through some of our advanced technical assistance. So there are benefits to signing on early, and we want people to get the full breadth of the program. So it will begin on May 1st and continue throughout 2015.
Just address an issue of great lead-in, and how long does this take? Everyone will be working their own work sites. So what should people expect as far as the length of time to participate in the technical assistance?
So we have a timeline worked out where we've allotted approximately 1 month for each of the milestones. So the total time for technical assistance will be about 4 months. I want employers to have an opportunity to plan and implement and gather some data on their program so that they can evaluate it. As I stated, the technical assistance providers will be with employers every step of the way to provide coaching and feedback. So currently right now the whole technical assistance period from assessment through evaluation is a total of 4 months.
Is there some type of certification to participating?
It's a great prize. How about that? So when employers complete all 4 of their milestones, they will receive a certificate really proclaiming them to be a Work at Health certified employer. And that certificate, and I see people having great pride in it, really provides tangible evidence that they've successfully completed the training, completed all 4 milestones, and have implemented a work-site wellness program using the science and knowledge base that Work at Health and CDC encourage.
Why offer this to the Train the Trainer participants? Why those that have been trained by Train the Trainers?
Well, Hugh, I have to tell you, and to be candid, in early 2014 when Train the Trainer participants were doing their training and really planning, we were sure that Work at Health would be expanded. So when we learned that we would be able to have an opportunity to provide this service, we knew that the group of employers who had been trained by the Train the Trainers were first on our list. So we wanted to be able to provide them with the technical assistance, which, as I stated, is an extension of that training immediately. So it's important to us to really support this group of employers. You've clearly already shown that you have a commitment to Work at Health and worksite wellness. So going up and participating in events like this and completing the training event and that was provided by the T3s we just want to extend the information and knowledge and support and technical assistance and make sure that these employers who, again, truly show a commitment that they have all the tools that they need to successfully implement their programming.
Okay, well, it sounds like this is really a new opportunity that was not initially available to those who were trained as part of the Train the Trainer. And so this is a great opportunity for folks we may not have initially been able to offer. I want to encourage any of those participants on the line, if you have questions, you can. If you haven't done so already, please feel free to use the right Q&A or question and answer section on the right side of your screen to submit your questions. And one question that I believe someone wants some clarification around, and so you mentioned that it takes 4 months to participate. Well, surely they won't be participating every day over the course of 4 months. Can you give us a breakdown of how many hours people should expect to participate within that 4-month period of time?
Excellent question, Hugh, and that's something that we want folks to understand. We anticipate looking at the work it takes and really how to implement a program. And, you know, every work site will vary, but we estimate somewhere between 10 to 15 hours per month over that 4-month period. So in the range of 40 to 60 total hours. And that includes things like consultations with your tax that you may need to have internally with your own health promotion team, then implementing programming. So 40 to 60 hours over the 4-month period is our estimate. And we want to try to minimize the burden. So that's why we want to make the tools easy to use, make sure that your technical assistance provider is responsive to your needs.
Thank you for that clarification. That sounds a lot better. I know a lot of us can fathom doing that number of hours within 4 months instead of spending the entire 4 months. So that's great. So that should give a lot of people time to not only do their work but also fully participate and gain from technical assistance. We do have a question that comes in for you, Nikki, around the technical assistance providers. So tell us a little bit about their credentials and what makes it so that they're able to offer this great service.
Hugh, and these are the group of colleagues that I'm proud to call colleagues. Many of them are nationally recognized experts in worksite health. I think I'm using air quotes, our youngest lab probably has almost 2 decades of experience really looking at wellness. So we have seasoned veterans in the worksite wellness arena. They cover the gamut from health educators to public health experts. We have a technical assistance provider who's actually on faculty at a school of public health at a major university, social work professionals, and they are all over the country. Just to name a few states: North Carolina, Maryland, California, Maine, Illinois. So we've really tried to find all over the country to provide that support. And I think one of the things that is interesting is that we have both a mixture of veterans who have already helped people through Work at Health in 2014. So that's, I think, one of our greatest assets is these folks have the experience of working through technical assistance. They'll be able to provide not only general worksite wellness expertise, but also expertise in Work at Health and how to maneuver through Work at Health. And even our new technical assistance providers have former experience in Work at Health and have been engaged in the program in other ways. So I'm really proud of this group of folks and proud to call them my colleagues. And I think they really provide the foundation for Work at Health. And I'll just throw in here as well as the technical assistance director, we're really, myself and my team are really trying to make sure that our program participants get the best technical assistance that we can provide. So while we're experts, we are really trying to check in on them. So they have performance metrics and evaluations. So it's not, we really take seriously the technical assistance that will be provided to program participants.
That given the credentials you've outlined for us, we can have a better sense of the value of the work that they're providing, again, really at no cost to the participants because of our partnership with the Centers for Disease Control and Prevention. And so that's great. Now, before we close, and I want to just remind participants, if you have questions, we have 5 minutes or more if you want to get your question in by using the Q&A panel on the right-hand side of your screen. But we have another question that comes in, Nikki. You mentioned activities that are a part of the technical assistance, including webinars. Can you let us know what topics will be covered during some of these events?
In here, and I think I'll start by saying one of our early events is really to orient program participants' minds around what technical assistance is. So we aren't just going to throw you in the deep end and say swim. So we want to provide some guidance and some information around what technical assistance will be about, and that will happen very early in the TA period, as well as providing information about communication products, how to communicate to your employees, fellow employees, what the Worksite Wellness program will be. And we have a great communication specialist who will be talking about some of our more traditional communication methods, from things like emails and bulletin boards, but also she has some exciting new technologies she's going to bring to the table. Also really activating your leadership, trying to figure out ways to make them invested and increase their buy-in. Looking at community partnerships, I think sometimes people forget that they are a part of a community, and there are ways to engage community partners outside of the employer that could provide services and extend the worksite wellness. So that's just to name a few of the events that we have planned upcoming during technical assistance.
As we come to a close, and again, if I see the participants, I'm sure that there will be excitement on everyone's face. So can you tell us about some of the immediate next steps that can be taken for those who may have not completed an application or may not be clear on the next step to be engaged in this Work at Health Technical Assistance Program?
That's great. So for those of you who have not completed an application, run, don't walk, and click the link to complete the application so that we can get you the materials that you need to move to next steps. For those of you who have complete applications, you have or will be soon getting some documentation that we need from you, some signatures and information. So you should be getting that if you haven't already gotten it in the next couple of days. And if we have that documentation in, we'll be asking for some data to be collected. All of this will be using online tools. And then on May 1st, we will be introducing you to your technical assistance provider and having you get ready and start. So those are the next steps for those who haven't and have completed the application.
Sounds like a relatively burden-free process in order to get started. I know that for those employers and other organizations that participated in the technical assistance last year, nothing but rave reviews, and so I am excited for those participating who want to be engaged. And so I want to just close us out this afternoon. Thank you, Nikki, for sharing your time and expertise today. So thank you to all of the audience that are participating. We've had a good number, practically all of our participants have stayed on to the end, have asked questions, and so we're excited that you are thinking, and if you have already a plan to participate in the technical assistance. I want to add that we value your feedback and appreciate you responding to the rating poll that will appear on the right side of your screen. If questions or comments about today's session, please contact us using the information on your screen. We look forward to hearing from you. And I also want to remind you, if you haven't already, that we will have another event, another webinar scheduled for Tuesday, April the 7th, also at 2 o'clock p.m. Eastern Time, where Nikki McCoy, who is our Director of Technical Assistance for Work and Health Program, will provide a live demonstration on completing the Centers for Disease Control Worksite Health Scorecard online. And so this is one of the tools that Nikki mentioned earlier. We're going to be providing a live demonstration. So thank you all for joining us today, and we look forward to your applications. And this concludes today's session. Thank you again.